Good morning, everyone. Welcome to the webinar, Wednesday, October 12th. We're in the thick of it now. OEP is just around the corner today. I'm joined by my friend and colleague, Anton of Ambetter. He'll be going over their 2023 plan offerings. And before we do that, let's just roll through some housekeeping issues. If you have a question, you'll put it in the question box to the right. We'll get to those at the end of the presentation. And this presentation is being recorded, so you all will get a complimentary copy of it later today. Here's my information. Take a moment, jot down my phone number and my email address. My colleague Eric Pouncey Jr. is also on this call. There is his information. You can follow us on social media. I encourage everybody to subscribe to the Monday Minute. This is where we house a lot of important information, key updates, so much stuff going on. And then there's a ton of information out on our website as well. And just a public service announcement about the ASP program. And as a Cornerstone broker, you have access to expert services from our agency services program that can help you with business outside your scope and planning for the future. We'll create a customized plan for you based on your specific needs to ensure that you, your family, and your business are covered. Contact us today to learn more. So it's right here at the bottom. You learn more about the agency services program. And let's talk about the Marketing Hub. This is brand new. From downloadable social media images to customizable flyers, Cornerstone's Marketing Hub is what you need to start managing your marketing in-house. You can access the Marketing Hub through the Cornerstone Resource Center. The Resource Center does have a username and password lock on it. Don't worry. You can contact Jess Larkin. If you have an issue resetting your password, it's pretty easy. It's been the same username and password you've had all along. But if you have any questions about getting into the Resource Center, just send Jess an email at jlarkin, that's JLARKIN, at crnstone.com. And let's toss it over to Anton in beautiful Chicago, Illinois this morning. And let's get this over to him. Anton, can you hear me?
Yes, I can.
Okay.
Okay, so let me know, Geoff, once you all can see my screen. I take it that
I
you
can see your screen.
Alrighty, great. Hey, good morning, everyone. I appreciate you all, inviting me to go over the 2023, Ambetter products. So you guys are prepared for open enrollment. So thank you for all that you do in years past as far as enrolling your clients with Ambetter. And I know we probably have some new folks that are who just recently appointed with Cornerstone this year. So this is your first time. Thank you for joining and, taking time to listen to hear what Ambetter has to offer in the state of Ohio and Kentucky as well. I'll show you some information about Kentucky as well on these slides. So I'll jump right on into it. Thank you, Geoff, for giving me time. Alrighty, so if you're not familiar with Ambetter, Ambetter was established in 2013. It is currently available in 28 states across the country. We are offered by the Centene Corporation and its state health plans, and Centene is actually based in St. Louis, Missouri. Centene is a Fortune 26 company with over 30 years in the managed care industry. Currently, we have 2 million plus members with Ambetter. We are the #1 marketplace carrier nationally. 1 in 7 ACA shoppers choose Ambetter. Ambetter is certified as a qualified health plan issuer on the health insurance marketplace, and our plans are designed to deliver high-quality, locally based healthcare to members. So just wanted to highlight some of the big pictures so you look forward to for 2023. Just as a reminder, open enrollment ends on January 15th, 2023. The enhanced tax credit from the American Rescue Act continues through 2023. We have a $0 copay for teledoc virtual urgent care visits, including mental and behavioral health on most plans. There's a $0 after deductible for some plans, including HSA plans. New for 2023, we're going to be introducing some CMS standardized plans. And just to let you know, Ambetter is expanding. So Ambetter virtual access has been added to 9 additional states, Ohio being one of them. We actually are introducing a Ambetter core plan into the state of Alabama. We also have Ambetter Select added into 2 additional states, which are Tennessee and Arizona. And also off-exchange plans will still be offered in the state of Ohio and the remaining states that you see on this screen. As far as what's new for this year, for Ambetter, we're expanding to Ashland County for 2023 open enrollment. Alrighty, so now you can see a breakdown of where we're actually located at throughout the United States. And all these states are being highlighted in this raspberry color are the states that we're currently in. And then you'll see like a light pink color go over for the state of Alabama because that's a new state that we just added for 2023. So as I mentioned before, we just added 1 new county for the state this year for the state of Ohio, which is Ashland County. Here, as you can see, it's I mean, most of you all, if you guys are based in Cincinnati, it's northeast of you, so more so closer to the Cleveland area. And then also, too, I wanted to show you a breakdown of what we've added for the state of Kentucky this year, because I know some of you all are close to the border of Kentucky and are also appointed there. So if you want to know some of the counties that we've added, so I'm not going to read all of them, but those are the ones that are highlighted in a raspberry color, such as Allen, Anderson, Clinton, Cumberland, Estelle, Lyon, Livingston, Simpson, Warren, Hart, Carter. So as you can see, some of the new counties that we are adding in the state of Kentucky that pretty much are covering up half the state now for 2023. Alrighty, so next I'm going to jump into our feature plans for 2023. And just to let you know, we are changing our plan names. So across the board, so our bronze, silver, and gold plans will have new names. So definitely want to make sure you pay attention to this. So for our bronze plans, our Essential Care 1 plan would now be called Clear Bronze. Our Essential Care 2 HSA would now be called Choice Bronze HSA. Essential Care 5 would now be called Everyday Bronze. Essential Care, the $0 deductible would now be called Elite Bronze. Balance Care 4 will now be called Premier Silver. Balance Care 11 will be Complete Silver. Balance Care 12 is Everyday Silver. Balance Care 28 will be Elite Silver. Balance Care 30 will be Clear Silver. And Balance Care 32 will be Focus Silver. In regards to our gold plan, Secure Care 5 will now be called Complete Gold, and Secure Care 20 will be called Everyday Gold. Now, just as a reminder, each Ambetter product has a different provider network, so you can help clients find their network providers for their specific Ambetter product with our online guide, with our online Ambetter guide, which I'm going to talk more about shortly. So, in regards to our new product names for our off-exchange products, currently we have for Silver Balance Care 201 HSA. That would just now be called Silver 201 HSA, and the Balance Care 203 will be called it will be called Silver 203. As far as with the gold, it will be we currently have Secure Care 201 HSA. That will be now Gold 201 HSA, and Secure Care 202 will now be called Gold 202. So in regards to renewal letters, most members will be informed that their plan will be renamed to a new Ambetter plan name. Plan coverage and benefits will remain the same. New ID cards for 2023 Ambetter plans will be sent out in December. Some members will receive a plan change letter if they have automatically enrolled into a similar plan due to a plan consolidation or termination. Renewal letters for exchange plans will not contain plan premium amounts. So any members that are plan on just auto-renewing, and these are members who want to stay on their plan and they have no life changes to report, no income changes to report, and they want to just keep paying their premium, they can do so and they'll auto-renew. The renewal letters will be mailed on October 28th. And now if members have any life or income changes, they can edit that information with their member portal account. Okay, just to let you know what all Ambetter plans include. Ambetter plans, all our plans are comprehensive major medical coverage, which includes ambulatory patient services and outpatient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitation and habilitation services and devices, laboratory services, of course, preventive and wellness services, chronic disease management, and pediatric services, including vision care. Also, too, what's included anytime a member has Ambetter, they have an opportunity to take advantage of our My Health Pays and Rewards. Also, our medical management programs. Also, we have $0 copay for virtual urgent care visits, including mental and behavioral health on most plans. Again, a $0 after deductible for some plans, including HSA plans. There's no exclusions for pre-existing conditions. And we have a local health plan staff. All right, so just to go over what are the difference in our plans, since we have a new type of plan that's available, or two type of plans that will be available, or two different type of plans that will be available in 2023. Now, the ones that you guys are most familiar with that we've had in the past, that we currently have, that we still have, is our Ambetter Core portfolio, which is our bronze, silver, and gold plans. These have our broadest Ambetter provider network. So anytime that you're doing a provider search, you'll choose the bronze, silver, gold network when searching the Ambetter guide. Again, these are the plans that are now going to be formally known as Essential, Balanced, and Secure Care plans, and they've been renamed. And members can visit any network provider, no referral needed. Adult vision and adult dental buy-ups available on most plans, and members can these are available in all Ambetter counties. Now we have a new virtual plan, which will be have a platform called Beglen, and there's no referral requirements for this. Now, this plan is designed for members who desire a virtual primary care experience. Then members can download the Beglen app and select the Beglen PCP. This plan again is designed for members who would like a tradition. This plan is not designed for members who would like a traditional brick and mortar PCP. Members on this plan should not expect to keep their current brick and mortar PCP. Now, with this, they have unlimited $0 visits with the Beglen PCP are included. Call sharing will apply for visits with non-Beglen PCPs. Referrals not required for their Beglen PCP to see most providers outside of their Beglen PCP, including specialists. There's a 24/7 virtual urgent care. Mental and behavioral health appointments are at zero cost to members. Members have access to $0 lab testing and preferred labs. Medications can be prescribed and sent to local pharmacies after virtual visits. There are no vision and dental buy-ups with these plans. So that's just something to keep in mind. And I'm going to go more into this in a few more slides so you can kind of see the difference with this. So now with this, this is our core plans, and this just gives you a breakdown of what they all include. Again, these feature our broadest provider network. Also, you have the option to vision and dental offering. And then also I'm going to talk about the CMS standardized plans for 2023. So for gold, as you can see, we have 3 gold plans: Complete Gold, which was formerly Secure Care 5, and Everyday Gold, which was formerly Secure Care 20. And we have a new plan that is Clear Gold. For silver, we have a total of 5 plans: Complete Silver, Everyday Silver, Clear Silver, and Focus Silver. And the new plan is Enhanced Silver. Next, we have 4 core bronze plans: Clear Bronze, Choice Bronze, HSA, Everyday Bronze, and Elite Bronze. So the lowest premium bronze plan is going to be our Clear Bronze. The lowest premium silver plan will be Clear Silver. The lowest premium gold plan will be Everyday Silver. And the lowest copay plan will be the Focus Silver. Now, as far as with the CMS standard plan, that these are plans that CMS, from what I've heard, require all carriers on ACA to carry a CMS standard plan in each category that they're offering plans. So for core, we have 2 core plans. With the CMS standard plans, there are no dental and vision offering. And the 2 CMS standard plans is just one for gold, which is CMS standard, and one for silver, CMS standard silver. All right, so moving along to our virtual access plan, which is new for the state of Ohio for 2023. Again, this is designed for members who desire a virtual primary care experience. They have to select a virtual PCP. Members should not expect to keep their brick and mortar PCP. Virtual access portfolio plans do not have a vision and dental offering. Referrals from virtual PCPs not required to see most providers. Again, as a reminder, it has $0 copay for PCP visits and $0 copay for lab testing. But there is a copay applied when they decide they want to visit a brick and mortar PCP specialist. And for these plans, we just have one plan for each category. For gold, there's an Ambetter Virtual Access Gold. There's one plan for silver, Ambetter Virtual Access Silver. And bronze is just Ambetter Virtual Access Bronze. All right. So now I'm just going to go just kind of give you an example what breakdown for each of some of these new plans that we're highlighting in these slides. Again, this is Complete Silver, which is formerly known as Balance Care 11. This has the lowest premium of any silver plan that we offer. I'm going to give you an example. When I go through these individual ones, I'm just going to mainly talk about the 94% AV. So as you see on here, but these plans also has a $0 deductible for both 87% and 94% AV. But like I said, I'm going to just talk about the 94%. So for that 94%, as mentioned, $0 deductible, it has a $1,700 max out of pocket. For PCP visit, is a $0 copay. Specialist visit is a $5 copay. Lab is $0. Preferred generic and generic prescription drug is a $0 copay. Preferred prescription drug is a $25 copay. Urgent care visit is a $10 copay, and the virtual urgent care is at $0. Alrighty, next is the Focus Silver. This is formerly known as Balance Care 32. This is the lowest cost silver plan that includes copay for PCP, specialist, lab, and urgent care and generic prescription. This has a 94, again, this is at the 94% AV. This has a $0 deductible. The back out of pocket is $1,200. The PCP visit is at $0. Specialist visit is at $5. Lab visit is at $0 copay. Preferred generic and generic prescription drug is at $0. Preferred prescription drug is at $20. And urgent care is at $10. And virtual urgent care is again at $0. Enhanced Silver. Again, this is a completely new plan for 2023. This plan has copays throughout the plan at $0 deductible at 87% and 94%. Again, at 94%, the max out of pocket is at $925. Co-insurance is at 30%. PCP visit is at $0. Specialist visit is at $40. Lab is at $30 copay. Preferred generic and generic prescriptions at $0. Preferred prescription preferred prescription drug is at $50 after deductible. Urgent care is a $50 copay, and virtual care is at $0. Next, I'm going to talk about our Clear Bronze, which is formerly known as Essential Care 1. This has the lowest premium bronze plan. It also has a matching deductible and max out of pocket. It features a copay for generic medication and urgent care. The deductible and max out of pocket is at 86%. PCP visit is at $0 after deductible. Lab and specialist visit is at 0% after deductible. Preferred generic is at $5 copay. Generic prescription is at $25 copay. Preferred prescription drug is at $0 after deductible. Urgent care is a $60 copay, and virtual care is $0. Clear Gold, which is our new gold plan, it has the lowest cost premium gold plan on the core portfolio. It features copays for generic medications, urgent care. The deductible for this plan is at $900. The max out of pocket is at $8,700. PCP visit is a $25 copay. Lab is 30% after deductible. Specialist visit is $60 copay. Preferred generic is a $5 copay. Generic prescription is $15 copay. Preferred prescription drugs is a $40 copay. Urgent care is $60 copay, and virtual care again is at $0. All right, so now I'm just going to talk briefly about the Ambetter Virtual Access Silver. Again, just as a reminder, you'll hear me repeat this a lot. These plans are designed for members who desire a virtual primary care experience. So it's a $0 virtual PCP, specialist urgent care, preferred lab. Now the deductible at 94% is at $100. Max out of pocket is at $850. So it shows you a breakdown on what the cost is for virtual PCV and specialists at $0. But if they were to go see a PCP brick and mortar, it's a $20 copay. A specialist brick and mortar is at $25. Lab, non-preferred, and lab, whether preferred or non-preferred, is at $0. Preferred generic and generic prescriptions, $0. Preferred prescription drugs is at $20 copay. Urgent care virtually is $0. Brick and mortar urgent care is a $20 copay. Ambetter Virtual Access Bronze, again, designed for members who are looking for a virtual primary care experience. The deductible is at $7,000. Max out of pocket is $8,550. Virtually, if they see a PCP, $0. If they see a brick and mortar, the PCP visit is an $85 copay. Specialist is $125 after deductible copay. Of course, if they see virtually for specialists, it's $0. Lab preferred is at $0. Lab non-preferred is a $75 copay. Preferred generics, $5 copay. Generic prescription, $30. Preferred prescription drugs is $160 after deductible. Urgent care, $0 for virtual. Brick and mortar urgent care is at $85 copay. Gold, which is designed for members who desire a virtual primary care visit. The deductible is at $950. Max out of pocket is $8,700. PCP's visit, as you can see, I'm just going to go over the brick and mortar just in case if you guys are wondering on this, because across the board, it is virtual, whether PCP, specialist, or lab, $0. But PCP, brick and mortar is a $55 copay. Specialist, brick and mortar is $90 copay. Non-preferred non-preferred lab is $20 copay. And urgent care, brick and mortar is at $55. Okay, adult vision add-on. These are for our members who are 19 years of age and older. So for routine eye exam, in-network is $0 copay, covered up to $130. Contact lenses and Lua glasses are covered up to $130. In regards to our adult dental buy-up, 19 years of age and older, again, this is for our in-network providers only. The benefit max out of pocket per covered individual is at $1,000. We have 3 classes for dental that we have. The one is routine dental, class 1. That's a $0 copay. Class 2 is basic dental, is at 50% co-insurance. Class 3 is major dental, and that also is at 50% co-insurance. And just as a reminder, we have no waiting periods for dental, so members can take advantage of that day one. In regards to our off-exchange plans, these are ideal for consumers who don't qualify for subsidies. They have affordable premium compared to on-exchange plans, same provider network and formulary. You can access the off-exchange plans through our EDE enrollment site powered by Health Sherpa at enroll.ambetterhealth.com. Some of the features on these plans include low deductibles, primary care and specialist copay for generic and preferred medications. Many plans have optional adult vision and dental coverage buy-ups as well. Alrighty, find a provider formulary, My Health Pays, and telehealth services. So I'll try to move through this as quickly as possible. So if a member wants to, let me go back here. So if a member wants to set up their member portal, they can do that at ambetterhealth.com. So this is a screen if they're on the home page of ambetterhealth.com. They click on the login, click on member. Once they click on that, they have the option of creating their account if they haven't done so, or they can they can log into their account if they have. So once they log into their account, it shows the home screen about what the member portal looks like. And as you can see, it shows them their PCP, claim information, ID cards, telehealth, doctors, pharmacies, payments, rewards. So we're going to go through a few of these. So if they want to look up a provider, so they have two options of doing so, whether going to ambetterhealth.com or doing it from their member portal. This example kind of shows if they didn't have a plan to look it up. So what I want to show you here is if, we have new plans that we introduced for Kentucky, right? So for Ohio. So if they, depends if they have our virtual access plan or our core plan, they will select that here when they're looking at that provider because it varies. Our provider network is going to vary based off what they have. So once that's selected, they can and they can edit that here as well. Making sure they can select the correct state, the coverage year, whether they have the bronze, silver, and gold plan, which is our broader plan, or the virtual plan. All right. So once that's selected, they enter the city and state, or they can do it by zip code. This example is going to show if they're looking for a primary care provider. So here on this list, a few primary care providers will show up. It gives you their name, whether or not they're accepting new patients, whether or not they're offering virtual visits. Members can also select the view profile, and it gives them a breakdown on what languages are spoken at the doctor's office, whether the locations that they have, what hospital affiliations they're associated with, their NPI number. All right. And also, too, depending on the type of search they'll do, they can also get a reminder, depending on what they're looking for, that, hey, if you're looking for a specialist, you may need to get a referral from your PCP to see this specialist as well.
Just a quick question.
All right, next. Yeah.
Anton, quick question. Can they use that
go ahead.
provider finder to look up dentists and optometrists?
Yes, they can. So what it's going to do is going to actually link them to another site. Same thing for vision and dental. So if they put in, a dentist or dentistry or things like that, it's going to connect them to, I believe, our Evolve site because that's who it's through the Evolve.
Okay.
So it'll connect them there to that provider breakdown list. So yes, it will give them providers that are in network for Ambetter.
Great, thank you.
No problem. So next, I'm going to just talk about our formulary list. So right now, if you didn't know, we do have our 2023 preferred drug listing on our website now. So right now, this example will show just 2022. So if you go there, click on that, the document will show up. If you know the type of drugs that your clients are looking to see if we cover, once you pull up this booklet, if you type in Control F, a search box will appear, and you can actually type in the name of their medication, and it'll show you if it is covered, which pages it is on, and what tier it falls under. So just a little FYI for you. Next, we're going to talk about the pharmacy options that your members have. So if they're on their member portal, they can actually manage their prescriptions. I kind of moved too fast. They can find a pharmacy. They can do a drug price lookup. They can request a prior authorization. They can also set up mail services and refills for their medications as well. All right, next we're going to talk about payments. So members from their member portal account, they can make payments directly from there by clicking on payments and make a payment there. Or if you have members who decided to not set up their member portal account, they can also go to our ambetterhealth.com website, click on For Members, click on the Pay Now tab, and make a payment from our website. They can either enter their policy number or social, and they'll link their policy, and they can make a payment from our site. Keep in mind, the policy is not active until the first month premium is received. So just as a reminder, once the open enrollment starts, you start doing enrollment. Some of these enrollments will start to appear probably after 48 hours on your broker portal. So you want to make sure, even though you see it, you got to remember that, hey, it's not active until that premium has been paid. All right, just going back to that payment option. different ways that members can make payments. They can call member services, they can mail in their payments, or they can use MoneyGram to send in their payment. Also, too, we have different payment settings, so they can update their auto pay if they wish to do so. They can manage, they can update their payment methods the way they want. They can enroll in paperless billing, and they can also download their invoices. All right, so post application, so this is the steps after you complete the enrollment. After enrollment, members can expect a pre-member letter and reminding them to make their payment if payment wasn't collected at the time of enrollment. Once the payment is received, members will receive their ID cards and welcome packet in about 7 days. Returning members should sign in to their member portal and complete the onboarding survey right away. New members can create a login for the member portal and complete the onboarding survey right away as well. So just want to let you guys know we have new ID cards for 2023. As you see on the top left, you see what our current ID cards look like right now. But now we will have a QR code, which will help them lead for co-pays, and it can deep links within their portal. So also too, you'll see that their ID cards will be color coded and let the members know what type of network they're in and type of plan they have. So as you see at the top for 2023, and some of these are because some states have Ambetter select plan and value plans and virtual access plans. So you see in purple, but you see the one that does not have a label, that's for our core plan. So members will just be reminded that they, what type of plan they have, especially when they're looking up providers. Next, we're going to talk about our rewards program, something that we, take pride in, that members can take advantage of. We have two different type of reward programs that members can do. The first one I'm going to talk about is My Health Pays, where members can earn up to $500 in rewards. It's set up, they can earn points by completing, certain health screenings and completing some healthy activities. Now, some of these rewards, and just to give you just like quick bullet points on how they can earn rewards in, as far as they can do an onboarding and well-being survey. So even if, they're new, once they can sign up to their member portal, they can take advantage of this, completing that survey, or your current members can do this too. Also too, they earn points by doing their PCP wellness exam. So, if they're taking advantage of, their preventive care, they can, earn points for that. And also we just have other type of screenings that, whether they're a child or an adult, this is available for all Ambetter members. So if you get any type of immunization shots, whether flu or either childhood shots, any cancer screenings, they can earn points by getting these type of screenings done as well. So the main reason why this was set up, because we want to make sure that our members are focused on eating right, moving more, being well, and saving smart. Members can use their points to shop on our online reward store, or members can convert those points into dollars to help pay their premiums and other healthcare related costs. So if a member decides to convert those points over to dollars, they'll actually get a Visa debit card to do that once that's done. So members can, use those points that they convert over to dollars to pay for some of their healthcare related costs, such as their monthly premiums, doctor co-pays, deductibles, and co-insurance. And they have the option to use that for, their monthly bills, such as their utilities, cell phones, transportation, education, and rent. So real quick, I know some of the questions that we get as far as like, okay, how many points do they earn for this, and how is that converted over to dollars? So right here is just a quick example. Once they on board and complete that survey, that's 500 points, which if they convert that over is $50. Their annual wellness exam, preventive screening, they can earn up to $2,000, which if they convert those over to points, that's $200. So I'll just, leave this on the screen for a few more seconds so you can see how members can earn points by completing some of these healthy activities and, earn up to $500. All right, so just some facts that if you're inquiring about My Health Pays, just some facts I just want to share with you. Nearly 3,000 Ambetter members have activated their My Health Pays accounts. My Health Pay members have collectively earned $24 million in rewards, and members who activate My Health Pays are more likely to renew. All right, so in regards to other rewards members can take advantage of, we have member discounts. So members, they can, take advantage of discounts as far as with home gym equipment, digital fitness classes, healthy eating services, and also local gym membership. All right, next, the last thing I'm going to talk about on the member portal is the TeleDoc, our telehealth services. So telehealth with TeleDoc is a 24-hour help for non-emergency issues. It connects experts to regardless of physical location. It helps members avoid long wait times at their doctor's office. It reduces costs of healthcare when a member PCP or clinic is not available. And it's also good for members who live in more of a rural area. So if they know it's going to take a while, the doctor's office may be a little farther for them, they can take advantage of the TeleDoc services. There's a $0 copay for virtual urgent care visits, including mental and behavioral health on most plans. It's $0 after deductible for some plans, including HSA plans. Next is our disease management, which is powered by WellFrame, and it helps members stay on track with their health and wellness. Members can check with their digital care managers. They can track real-time progress, such as with their blood sugar and blood pressure. They can view clinical alerts and reminders, and they also can integrate their biometric devices as well. So members eligible for services include, but not limited to, frequent inpatient admission and ER visits, pregnancy through delivery and postpartum care, and members experience multiple comorbidities as well. Alrighty, so I'm just wrapping up right now. Just wanted to, kind of share with you some top reasons to sell Ambetter in 2023. Again, just a reminder, we're ranked 26 on the Fortune 500 list. We're the #1 ACA carrier and been that way for the past 5 years. Ambetter cover 1 in 7 lives nationally. We've been offering products in the state of Ohio since 2017. We offer off-exchange plans as well, which you can take advantage of for your members who that don't qualify for subsidy. We have our TeleDoc program with a $0 copay. The MyHealthPays earns up to $500 annually, which can reduce monthly premiums by $41. We also have value-added benefits such as Save Smart for your baby, health management programs, 24/7 nurse advice line, and care management. Also, we have our advanced broker portal, our dedicated broker support team, our enhanced direct enrollment tool that's provided for you for free anytime that once you're appointed with us. And also too, we just wanted to talk about our network. So these are just some of our network highlights. This is not our entire network in the state of Ohio, but some of our highlights. So as you see, some of our networks in the Cincinnati area, as far as TriHealth and Mercy, Schreiers, and Adams. But one thing I wanted to highlight right now that's in that Cleveland area that we just added is the University Health Hospital Systems, which is new. So they have numerous, hospital locations, and, that network is huge. So that's a big benefit for us. So if you were not aware, we did just add University Hospital Health Systems to our network. Also, too, if in the Columbus area, we have Ohio State University. Toledo area, we have Mercy Health System, St. Luke's and Woods County. And I believe I have one more slide just so you guys can see the network highlights for the state of Kentucky as well. So just in case you didn't know, we have University in Louisville Hospital, University of Kentucky Hospital, St. Elizabeth Medical Center. So I'll leave this on my screen for just a few more seconds so you guys can see some of our highlighted networks in Kentucky. Keep in mind, as a reminder, this is not our entire network. These are just some highlights that we just wanted to point out to you guys, some of the hospitals that we do have in network. But like I said, it's not our entire network. Alrighty, so I just wanted to leave some contact information for you guys as far as with our broker sales support team. So anytime you need to reach out to broker support to research and member inquiries, commissions, broker web support tools, find a provider, contracting follow-up, you can reach broker support at 855-700-7985, option 2.
I'd like to get to some questions here, and maybe I can answer a few of these. Will you get a copy of these slides? Absolutely, you will get a copy of these slides after the presentation. He went over the hospital network highlights, and you'll have a more comprehensive list of hospitals when the Ambetter system is updated. Look for that the last week of October. And again, there's new plans. As a result, you have to look up the provider finding by the plan name. But by and large, I think Ambetter is holding serve this year. I don't anticipate too many, if any, networks being dropped, so that's good. That is exciting news about Margie. I can't express my happiness enough about them adding This gives our partners in Northeast Ohio some real alternatives. So traditionally, I think only one carrier had and now we've got at least two. And so University Health Systems or University Hospital Systems in the Cleveland area, that's what I'm talking about. Okay, so let's see here. Maybe Anton can just phone in and we can get to these questions. Everybody will get a copy of this presentation. And just getting back to some more questions. Will Ambetter have any children's hospitals in Ohio in network? Again, we'll have to consult the provider network at the end of the month, but I don't believe they will have St. Children's. So traditionally, that's just been one carrier having that. That's the hospital system down here, pediatric hospital down here in Cincinnati. So I don't think they're adding children's. And how will the member find their renewal rate? Typically, it's out on the Ambetter portal by the end of the month. So look for that starting, October 15th and beyond. How will the members find their renewal rates in 2023?
Well, you would have to go in and run those rates. So they're not going to get anything. Well, in the past, we'll send those renewal letters, which was it was always an estimated premium amount. So you actually would need to go in order to know what their new rates will be for 2023 to, run that pricing for them. So
okay.
even if you may have members say, hey, I just want to stay, nothing changed, I want to stay the same, then it's, chances are their rate is going to change, either go up slightly or may go down depending on where they're located at in pricing.
Okay, but if I'm not mistaken, don't you also post that out there on the producer toolbox, the new plan?
What?
On the broker
It
portal?
gives them, on the broker portal, it does, and that's an estimate. So in the past, I'm not sure if they changed this, but in the past, if you click on your policy from the broker portal, like if you click on someone and click on their policy number, it gives you that breakdown as far as like their information. In the bottom right corner, I forgot what it's called. I'll probably have to look it up, but normally it would tell them like a estimated rate for that person for 2023. In the years past,
Okay.
It'd be 2022. But don't go by that because, like I said, if that is listed there, they're pulling it based on data that they have from the previous year. So you still want to go in and update that.
Okay, great. So next question is, will Ambetter have any children's hospitals in Ohio in 2023?
Currently, right now, I have not been told that we have added anything new. I just know currently we added the university hospital system to our network for the state of Ohio. And I remember when we first got that news, it was a couple months ago. I did do a listing of it, and I may have to pull it back up. But correct me if I'm wrong, and maybe someone is familiar with this. But does that university hospital, do they have a children's hospital? I thought maybe I saw one. I could be wrong, but I have to double check.
We can find out. I think there's one called Rainbow.
Okay, Leah, and I'm gonna double check, and I'll circle back with you because I did get a breakdown listing of all the hospitals, but like I said, it was a few months ago. But I thought I saw one that did include a children's hospital.
And one of our astute colleagues just responded, yes, Rainbow Children's in Cleveland is a part of So that's good. And again, proof is in the pudding. Let's find it on the provider finder. and that's the coin of the realm, as we say, that's great. So we got more questions. We'll, get going here. So glad we get you back on the line. Can doctors sign up to be virtual providers? And if so, what do they have to do to sign up?
So yes, if they go to ambetterhealth.com, we do have a providers tab for providers who's looking to join Ambetter. So they have to fill out an application, and it goes directly to our provider team, and they, work with them in order to, approve to get that contract. So yes, there is a link that they can fill out from our website that goes directly to our provider team. And just to go back, I just pulled up this list. So yes, the rep was right. I just knew it is Rainbow Babies and Children Hospital, falls under University Hospital. So yes.
And that's in network for Ambetter 2023.
Yes.
That is a game changer, guys. That is a wonderful pediatric hospital in Northeast Ohio, and that's going to be a game changer. So next question: if someone thinks they're having an emergency situation and goes out of network, but it turns not to be an emergency, would Ambetter still cover them as in network?
No. So the out of network, normally, on the summary of benefits, the only thing that they cover out of network is emergency room services and emergency, I believe, transportation. So if it's deemed not an emergency, then yeah, they risk that claim not being approved by Ambetter and paying. So
Okay.
so put it like this. Hey, I know how that was kind of worded, so let me just clarify. So they said, well, they deem that as in network, I believe, how you kind of phrase that, Geoff. So even if they did go to emergency room, right, and it's out of network, but it was an emergency room service, it'll still be considered out of network. But Ambetter, if it's emergency, room service, and it was deemed an emergency, it'll still be coded as out of network, but they'll still pay the claim because it falls under that emergency room benefit.
Okay. Thanks for the
So
clarification.
they wouldn't code it as in network. Yeah.
And just as we wrap things up, it's 10:23. Give a few more minutes here for some questions. Do all plans have same hospital network, or do these vary as well between gold, silver, and bronze? Good question.
Yeah. So so it's a good question. The core plans, no. So whether you have, and when I say the core plans, gold, silver, and bronze, like they asked, no, the network is entirely the same. So it doesn't matter the plan that they have within our core plan. Now that we're getting into the virtual plans that we introduced this year, that can vary network. So yeah, they definitely want to, when they're doing a provider search, look and see what is make sure that they are selecting, and then also too, just to let you know, the off exchange as well, same network. So if you have an off exchange plan, because we only have two categories as silver and gold, that has the same network as our core plan, just to let you know. But in regards to our new portfolio that we're introducing this year, the virtual access plan, that network does vary.
Okay, and moving right along, what increase did Ambetter file for 2023 in Ohio?
What increase?
Right.
I'm sorry.
Rating increase? I mean,
I don't know that off the top of my head. I do know in certain areas, and this is something I can kind of talk with folks one-on-one if they care to go into more detail, because I just don't have that information in front of me right now. I do know where we did increase that in certain areas. In certain areas we did not. So it kind of varies throughout the state, to answer your question. It's not just one rate across the whole state. Each section of the state of Ohio is different as far as pricing.
Okay, this is a Cincinnati
and that's
question.
Like that, and that's just
okay.
Yeah, and that's just like that for most states as well,
Yes,
just not limited to Ohio.
Yeah, it's been very tough to get any detail from any carrier. So I understand. I understand. So next question, and this is a Cincinnati-based question, is Christ Hospital in Cincinnati, will it be a network?
Is that, so you may have to refresh my memory because I feel like that may be one of the hospitals. Is that currently showing in network now,
Yeah.
or is that out of
Yeah.
network right now?
It's a network.
And I just don't want to confuse that with another provider because I feel like we had another provider in Ohio that was saying they were leaving.
Well, I guess the proof's in the pudding. I guess we want to access the provider finder last week of October and go out there and look, because that's when you're going to be able to start quoting, I'm told, by the CMS. And so I think maybe we just wait and see. I have no reason to believe
let's wait
it would
and
not
see.
be.
And I can I can circle back to confirm, but yeah, and I noticed that we did list that hospital as far as one of the the highlights when I did the top reasons of sale as one of the ones listed in the Cincinnati area.
Oh,
so it's quite possibly it would we didn't, I mean, like I said, on that sheet is not our entire network, but we like to highlight some of the more popular hospitals in the certain section. And I'm looking at it now, and we don't necessarily have that on my slide. So it's quite possible they may not be in network, but if whoever had that question, feel free to email me or contact me after this call, and I can follow up with you and get an answer for you. Or, as a matter of fact, either that, or if it's a general question that more people want to know, I can just follow up with, I can just send a message directly to Geoff, so Geoff can relay it to their team.
Yeah. Let's just stay tuned. As things unfold, we'll have a lot more detail last week of October, and we'll be happy to guide you in the right direction. So we got a ton more questions just flowing in, and let's get to them. So to reiterate, you will get a copy of the presentation, and then another. Let's see here. University of Cincinnati Hospital System. We'll verify that later. Again. No, I don't believe that would be dropped. No reason to believe it would be, but we can verify that last week of October. And then a question about dental. A lot of dentists are listed on network or in network. However, when we called them, they dropped off. Is this any better this year?
So actually, that's actually a great question, because I have something I'm going to pass along to you, Geoff, after this call. So in the past, and this is not just limited to dentists, any type of provider, where we have come across a situation where a provider shows a network, a broker or member will call and they say, oh no, we no longer accept Ambetter. Now, we've had good and bad results from this, and where in the past, someone will let me know, I'll reach out to our broker support team, because they will reach out directly to our provider team. The provider team will confirm whether or not that person is in network. A lot of times we have situations where the provider needs to be educated that they do currently have a contract with us, and they, should be accepting Ambetter. So when that happens, the provider team will reach out, and they'll confirm, like, oh no, we spoke to this provider, you're set, you shouldn't have any problems, you can go there. Or if we have situations where the provider team will reach out and they'll confirm with us, hey, this person does not accept Ambetter, we're removing them from the site. So now they kind of want to cut out myself and broker support as the middleman, and they actually want to hear directly from the member and the broker directly. So there are tabs within the, and I'm going to send this link to Geoff so he can send it out to the team. So basically, anytime you guys have a problem where a provider is showing up on our site in network, but they say they don't accept Ambetter, we want you to fill out this little form electronically that goes directly to the provider team, and they can get back with you and let you know, like, hey, we spoke to the provider, they do accept Ambetter, or no, they do not accept Ambetter, we're going to remove them from the site. So I'm going to send that to Geoff after this call. It's actually links broken down by state. So it's called Report a Problem. So you can just hit the tab that you're a broker and fill it out, like, hey, this person appeared. You just put in their information that shows on our site, and it goes directly to our provider team. So to answer your question, when you run across those problems, we're trying to, be more accurate with that.
Fantastic. I love it. Total transparency. So next question, and this is a good one. I love this question, Betsy. So can a Cincinnati policyholder go to Rainbow Children's in Cleveland and be a network?
Yes. So if a member, if an Ambetter member, and this is just general, you can use your coverage across state lines. I know this question was more so geared to in-state lines,
Yeah.
but yes, you can use your coverage as long as you go see an in-network provider. You can use your Ambetter coverage anywhere.
Okay.
So yes, you can go see a university, hospital, provider, even though you're in Cincinnati.
Yeah, that's fantastic. That's that's another great pediatric hospital we have here in Ohio. We've got several. And with that, I'm going to wrap things up. Everybody will get a copy of this presentation plus some of those handouts that he mentioned. As things unfold here in the next couple of weeks, we'll have more information for you, hospital system detail, that sort of thing. We'll have more webinars for you as well. But I certainly want to thank Anton for joining us today. And Anton, any final thoughts?
No, just thank you everyone for taking time. Sorry about that whole connection issue. I don't know what happened at the end, but thanks for being patient. Thanks for taking an hour out your day to listen to me. I appreciate it. Good luck to you all during open enrollment, and thank you for the business that you have written for us so far.
Have a great day, everybody. Thank you.
Take care. Bye.